So we are here in Austin Medical Associate. We have Dr. David Sosnok and we have also Dr. Mark Silverman. We're going through some questions for them to see what they are recommended to the staff and their patient for what we going through now for coronavirus. We do understand a lot of our patients, they keep calling, everyone going crazy. A lot of doctors close. A lot of doctor doesn't want to take their patient if he has the symptoms. But we thank you, Dr. Mark Silverman and Dr. David Sosnok, and the staff working in the place here. We're still open. We're still seeing every patient calling. We are here for them. We try to help everyone. We try to help the community. But at the same time, we receive a lot of questions from our patient too. So we can go recommendation with Dr. David Sosnok and Mark Silverman to see how we can deal with this crisis. We start with Dr. David Sosnok.
First thing I would just like to say is, yes, our door is still open. We're still seeing patients every day. Despite everything you may be hearing and going on around us, everything, most people obviously are still doing perfectly well, and all of us that are here and our staff are still doing very well, just following the normal universal precautions that we always do to try not to transmit any infection to anyone at any time.
We just want to reassure you that we are here, we are seeing our patients, we're not closing our doors like some of these other offices around here we're hearing. You have questions will be answered. If you want to call, you're free to come in, we understand. You want to give us a call, we return all of our phone calls every day. We could be paged in the evening after hours, that's fine. We understand everyone has a certain level of anxiety right now, they're a little out of the norm, but we're here to answer your questions. I'm sure you're watching a lot of things on the news, on television. It's making everybody go a little nuts with too much misinformation out there as well. We're here to answer your questions and keep things straight. And as soon as we find that new information, new treatments, possibilities, we're here to offer it. As long as we're able to, we're going to keep going, and we're here for you. You have to understand that we're on your side. We want to do what's best for you.
One of the good thing here, and we really want to thank you guys here because, as you guys mentioned, the door is still open for everyone, not only for your patient. You also your door open for new patient. They not able to find their doctor because they close or they doesn't want to see them. So we thank you for that. Still seeing patient, still provide your service for everyone in the community here. This is what we believe. Medical field. This is when you get your doctor when you need your doctor. It's not when problems or anything happen or crisis happen. Your doctor close or they doesn't want to see you because of that. We thank you for this. We thank you. Your staff is here helping the patient and helping everyone answering the calls. And as what you guys said, we are here for everyone. We try to help everyone. But once again, don't go crazy for what you keep hearing. From the news or someplace, and this is what we're going with the doctors and the staff. They keep hearing, we're getting a lot of calls from patient, and this is what we're going to cover. What exactly they hear from patient and what is the answer from the doctors. So let's get from the staff. If you guys have any questions, you always hear it from the patient.
For example, let's see if some patient who was staying at home and they have the coronavirus and they have their children, and if it's female, their husband, or if it's male, his wife. So what's your advice for them?
Well, obviously, they're going to have to do all the hand washing, the social distancing, everything else you've been hearing about over and over again on the TV. But obviously, if they're living in your household, you have to assume they're going to be infected. There's only so much isolation you can have in your own home with your own family. Husband, wives, children, you have to assume if one person in the household has it, you have to assume everyone has it in the household. And the whole household is going to have to be quarantined until at least, that time period, the 7 days plus the 3 days of having no symptoms, and some people are out to 2 weeks they're quarantining, although that date is changing day by day. But it's only, look, you have to love your family, you have to hug them, kiss them. These things are going to happen, and you have to just go with the presumption that everyone in the same household will be passing the virus along to each other. It's highly infectious. Thank goodness, though, the data is that it may not be as deadly or as lethal as it's making it sound. It seems like a lot of our patients, for example, are doing very well who've had this, and a lot of them are recovering already. So, just to keep things in perspective, you have to do things in reason.
Yeah, since most times any result that comes back is long after it was sent, probably most people have been exposed in some way, but not necessarily everyone who's exposed gets sick, and not everyone who gets sick gets a very severe illness either. So it's certainly possible that you could have known or mild symptoms even when you have been exposed to the virus.
Doctors, we have many patients calling and asking, how do I know if I have corona? How do I have allergies? How do I have a cold? Do I have the flu? What is your recommendation for the patients if they're calling with those symptoms?
Well, if you have symptoms like that, chances are you have to act with the presumption that you do have the coronavirus till proven otherwise, because the chance of you infecting somebody else is very great. So you have to take all the precautions. If you're not feeling well, you're feeling under the weather, and even say, oh, this is my usual sinus infection, I get this 2 or 3 times a year. Well, guess what? This may not be your usual sinus infection. And until you're tested, we don't know. And most people, if they're not that sick, they don't recommend testing at this point. It's not going to change the management.
But if you are mildly ill with whichever of those kind of things it is, the best thing to do is just take your normal over-the-counter medicines and stay home. This way you minimize exposing other people to the illness. Of course, anything that gets more severe, with especially shortness of breath, trouble breathing, that has to be evaluated in the emergency room, because that is something that requires an x-ray and only the kind of things that can be done in the emergency room. The in-between things, you're more than free to talk to us, and we are here, and we've been evaluating people with all these in-between type of symptoms as well.
Also, one of the questions that we are getting from patients, that they know after 10 days that they've been exposed to someone that tested positive, but they have no symptoms, but they're keeping that in their mind. They're going a little crazy. They saying that they want to get tested for it, even having no symptoms. What are your recommendations?
Yeah, the CDC does not recommend anybody with no symptoms be tested. Eventually, we'll have other kinds of testing done that will probably be able to prove that people already have immunity to it. But at the current time, there's certainly no reason to test if you don't have symptoms. And since most people would have only mild symptoms, or maybe even no symptoms, it's possible that you already recovered from it. The only thing is that we don't have an ability to tell you for yet. And so once you've gone through that normal quarantine period and you don't have any symptoms, there's nothing for you to do.
Do you guys have any other questions?
No.
No, it's been very helpful. Thank you.
You're welcome.
So once again, we thank you guys for keeping the door open for your patient and any other patient they want to come to make sure they are okay. Once again, for all our patients and for everyone in our community and in general, even information for all American people, don't panic. We are here for you. Doctors is here for you. We are willing to help, and we are helping everyone. This is the season for the allergy. A lot of people will feel the symptoms exactly close the same symptoms for corona. Don't get panic. Call your doctor. Call us. We are here to help. We are here to give you some advice. So don't go crazy. Don't panic. Just calm down and call us.